This video is intended for patients who have recently undergone hip arthroscopy. We'd like to take a moment to show you how to get around and some of the other activities and stretches that can be done at home prior to your first physical therapy appointment. Wendy is a couple weeks out from her hip arthroscopy. She is demonstrating how to flat foot weight bear with her crutches. Notice that she is keeping her leg on the ground while using it in a normal gait pattern, but only putting the weight of her leg on the operative leg while using the crutches to offload the rest of the body weight. Also, getting up and onto tables, bed, or in and out of cars can be very painful, and so she is showing you how to do that in a less painful manner. Once again, watching her crutch walk, and then as she goes to get on the table, notice how she lifts her leg with her arms so as to not engage her hip flexor muscles, as doing so can aggravate them and prolong your recovery. Alternatively, you can hook the leg with your non-operative leg and lift it up as shown here. Next, our physical therapist is going to show you some stretches you can do at home. Please excuse the background noise.
This is Wendy. She's about 2 weeks out of hip arthroscopy on the left side. We're going to go over some of the beginning stretches and range of motion activities she can do. We start with laying supine, leg in neutral, making sure she's not externally rotated. Bring her non-surgical leg towards her chest. Try to get her hip to neutral only, so I do give her a little pressure. Doing okay. And we're not allowed yet to go beyond neutral, so we just try to get her to zero only at this time. We also try to avoid hip flexion actively, so the next exercise we'll do is some passive hip flexion. And bring her up slow, trying to not allow her to do that on her own. We try to get her to 90. And then if there's any more that comes easy, we'll progress towards 120. What we watch for is no pinching in the groin area. And if they complain of pinching, I try not to push through that. Then we work on simple circumduction. You can do that with the knee flexed. Or the way I like to do it even better is with the knees straight. Hip about 45 degrees. Get them to relax. Little gentle traction. And make circles as they tolerate size-wise. And the last thing that we really introduce for this early motion is just log rolling into internal rotation, which is very simple. Again, avoid pinching in the groin. Turn their toes in, back to neutral. Just like so.
Okay, so Wendy is about 4 weeks after her hip arthroscopy, and Wendy, do you mind just telling us a little bit about the first couple of days and how you were sleeping and how you were getting around?
Sure. So the first couple days, I needed to only sleep on my back. After a couple days, I was able to sleep on my non-operative side, and I slept with a pillow between my knees. When I slept on my back, I found it more comfortable to put pillows next to me to kind of help keep me in neutral, and maybe a little bit of internal rotation was a lot more comfortable.
Okay, awesome. And how are things going now? 4 weeks out?
4 weeks out, doing good. Haven't had much pain, and my motion is a lot more comfortable now.
Awesome. Okay, thanks.